started. Welcome to ANHISA and IOSH's joint webinar discussing global regulations and policy on mental health and well-being. As we get going, let's cover some practical details. Due to the number of participants, we've muted everyone to ensure good sound quality. And as always, thank you for submitting your questions during registration. We'll answer as many questions as possible during our Q&A sessions. If you have any follow-up questions, please email info@anhisa.com and we'll direct them to Elise and Ivan. It is my pleasure to introduce to you today's presenters and experts. Elise Saad is an EHS regulatory consultant at ANHISA, focusing on several Arab-speaking countries in the European Union. Dr. Ivan Williams is the Occupational Safety and Health Research Advisor at IOSH. Williams holds a PhD in labor law and occupational safety and health. Before we begin, let's meet your host companies. ANHISA helps multinational companies comply with EHS laws, wherever they operate or put products on the market. We do this through our global offices and 75 in-house regulatory analysts who represent over 40 nationalities. Our global coverage means that we can provide off-the-shelf content and solution for over 285 jurisdictions worldwide. One of our primary services is our regulatory forecaster, where we track, analyze, and report on EHS law and policy developments. It's this service that's helped us compile today's webinar. I now pass it on to Ivan Williams to introduce us to IOSH.
Thanks, Lindsay, for your kind introduction. First of all, I'd like to thank the opportunity to ANHISA for this collaboration opportunity, to Elise and Lindsay for sharing your knowledge with me on such an interesting topic, and to Tia for approaching me to deliver this webinar. For those of you that might not know, IOSH stands for the Institution of Occupational Safety and Health. IOSH is the world's leading professional body responsible for safety and health in the workplace. The institution was founded in 1945 and supports nearly 48,000 members from more than 120 countries. And IOSH is not only a membership body, but has an international NGO status recognized by the International Labour Organization. It is also a world-leading developer of certificated safety and health training courses. As you'll be able to see from the facts and figures on the slide, we're also known for being a significant funder of research into a wide variety of occupational safety and health topics, and also for running an award-winning campaign known as No Time to Lose that looks to raise awareness of a significant health issue, occupational cancer. I think it's also worth mentioning our Work 2022 5-year strategy that was launched back in April 2017. Work 2022 is divided into 3 pillars: enhance, that focuses on developing competence and capability for OSH professionals; collaborate, through building partnerships with like-minded organizations like ANHISA; and influence, that entails knowledge, learning, and research initiatives. And within the current strategy, mental health and well-being in the workplace remains as one of their priority areas for IOSH to act as a champion, as a supporter, advisor, advocate, and training as well. In this particular field, IOSH recently published 2 pieces of research. Mental health first aid in the workplace, a piece of research from Nottingham University that evaluated the effectiveness of mental health first aid training. And Return to Work After Common Mental Disorders, a study that looked into the barriers and facilitators in return to work from a multi-stakeholder perspective. And it's fair to say that we are currently funding 2 projects in this particular area with Cardiff University on safeguarding seafarers' mental health and the effect of the return to work process on sustainable work resumption among workers on sick leave due to mental health problems with Tilburg University in the Netherlands. We have also recently produced a white paper, Workplace Wellbeing, the role of managers in promoting positive mental health, together with management today in the UK. So these are some of our resources that help us to position ourselves in advocating that mental health and well-being is to be given the same priority as physical health in the workplace.
Thanks, Ivan. This webinar is the latest installment in HISA's webinar series. We host a number of these each year. For those of you that are not aware, we also host a library of past webinars on our website that you can check out at hisa.com. Today's webinar will give an all-encompassing perspective of mental health and well-being policy across the globe. Our experts will start with defining mental health and well-being, move on to the challenges of regulating mental health, delve into global law and policy directives, and then go into a Q&A concerning questions you submitted during registration.
Thank you, Lindsay and Ivan, for the great intros. So before we begin to tackle our main subjects, as Lindsay outlined, I will go through some statistics. Statistics, as we know, is a worldwide practice that is being increasingly used by regulators to define their strategy. It's also a great predictor of future priorities on a national level and the key driver behind policy changes. To begin, we have a survey from a well-known firm, according to which around 32% of all UK adults in full-time employment were found to be suffering from mental health problems in the workplace. In the US, we have high numbers as well, with about 65% of employees citing work as a significant source of stress. These are few figures and numbers, and there is a lot of those around the topic of workplace stress. Now, what about the cost to industry? According to the World Health Organization, it is estimated that job stress, depression, and anxiety cost the global economy more than $1 trillion a year, and that is in absenteeism, turnover, diminished productivity, medical, legal, and insurance costs. Now, I will elaborate on the definitions, because mental health and well-being at work are often used interchangeably, and it's very important to define these concepts in order to have a better understanding of their implications. Now, when we think about mental health, many words come into our mind, like anxiety disorder, behavioral problems, stress, coping mechanisms. However, in this webinar, we will focus on the concepts of mental health and well-being. So in this slide, as we can see, the definitions of mental health and well-being are very similar. Only slight differences exist. For instance, the focus in mental health is on the coping mechanism and the productivity of a human being, whereas well-being focuses on the quality of working lives, including occupational safety and health aspects. We also have several elements for good mental well-being, and that include the ability to build and maintain good relationships with others, the feeling of being engaged with the world, the adaptability in times of change and uncertainty, in addition to many other elements.
Continuing with a listed definition of mental health and well-being, I really think this table is quite representative of the traditional and evolving trends in mental health and well-being laws in the workplace in many countries. So in this context, a traditional approach considers mental health as being influenced by factors from outside the workplace. And on the contrary, a modern approach tends to be more inclusive and holistic by considering both factors inside and outside the workplace. The prevailing trend still encourages superficial initiatives rather than organizations adopting a more strategic approach to how they manage psychosocial risks. And the third aspect reviews how mental health and well-being programs are normally measured on cost and benefit perspectives, while data measuring effectiveness is hardly reviewed. And I think think that this slide helps to provide a comprehensive picture of the state of the art for major trends in law in this particular area. So it can't be denied that more frequently we can find in some countries signs of determination to address mental ill health across all fronts by adapting regulations on well-being and mental health to better reflect today's changing world of work. And this will include improved enforcement on this area. From a regulatory perspective, the following initiatives are being reviewed. The concept of the employer duty of care is changing from a legal approach to a moral duty of care. And liability for inflicting mental suffering is also being considered. The protection of mental health could somehow be included in collective bargaining. We're also seeing some changes in working time and workplace violence regulations. And in summary, what we are seeing is how regulations are becoming more aggressive in issues related to working time and work-related stress. And at the same time, the promotion of workplace well-being is also gaining legitimacy on the regulatory agenda. And from a business perspective, the trends are focused on the stronger occupational link between compensation and mental health, a progressive acknowledgement of the positive benefits of workers' mental health and well-being in the business results. This could take the form of productivity aspects and also quality of life of employees. Companies are also being encouraged to address psychosocial risk through proactive management systems. And apparently there's a perception that addressing mental health could be the next challenge for not only for organizations but also for occupational safety and health practitioners. We have gone through the trends associated to mental health and well-being definitions and the major trends in law practice, but I think it's always important to have a better understanding of the context where health and safety professionals are operating. And that's exactly the reason why we need to pay attention to what researchers call warning signals. And this can come from different sources of information and knowledge about this particular issue in the society. And I do believe that that's exactly the reason why I found the 2019 Global Risks Report from the World Economic Forum so fascinating. The report goes through major macroeconomic, environmental, geopolitical, and technological structural issues affecting at a global scale and that are likely to have an impact in policies and practices. To this respect, it reflects on how declining psychological and emotional well-being is affecting the wider global risks landscape and the working environment in particular. So this edition covers the human side of global risk, and it is completely unprecedented how trends that can have an impact in mental health in the workplace, such as changes in technology, the prevalence of psychological and emotional strain, addictions, workers monitoring, and workplace stress are included for the very first time in the scope of the report. The study also identifies psychological stress related to a feeling of lack of control in the face of uncertainty as a global issue. So I think this is it from the World Economic Forum report. And Elise, are you happy to provide more insights on the different trends that are impacting workplaces?
Sure, Ivan. So as you explained with the global trends in the workplace and in today's globalized world, we have many factors that determine how mental health is addressed and how measures are adopted and adapted to the changes. From the major trends that are impacting workplaces and changing the world of work as we know it, we have technology and digitalization. We also have new forms of work and labor relations. The organizational changes, which are becoming more and more common, also play a very big role in the increase of workplace stress. And finally, we have the increasing demands at work and work pressure. Now I will pass on to Ivan so he can elaborate on the challenges in relation to regulation.
So far, we have been providing some snapshots on the importance of fit-for-purpose regulations in this challenging field. But when it comes to regulations, there's a logic assumption that needs to be clearly stated. Higher levels of awareness go in hand with long-term or robust regulatory frameworks. But there are some reasons why we are not there yet. And here we can see some examples that help to perpetuate how this complex issue is managed from a regulatory aspect. I think it is worth pointing out that mental health problems remain unaccounted on the list of occupational diseases for most of the countries in the world. We've recently seen how burnout has been included in the latest revision of the International Classification of Diseases of the WHO, the World Health Organization, as an occupational phenomenon, not classified as a medical condition. I also think that both Liz and Lindsay will probably agree that these risks have been traditionally considered by health and safety practitioners as soft, as practitioners have always been trained and educated to tackle physical risk. And there's still much to do to control physical occupational hazards, reason why resourcing from a regulatory perspective is still an ongoing issue. To this respect, there's still a lack of understanding of how to consider mental health issues and support those with pre-existing mental health conditions and those who have mental health conditions resulting from work-related psychosocial factors. And of course, this significantly differs based on levels of general socio-cultural tolerance, attitudes, and workplace attitudes in particular, stereotypes and public perceptions of the issue in different countries. And in order to exemplify these challenges at a policy level, the International Labour Organization recently published a thorough report, Workplace Stress, a Collective Challenge. And one particular section of the report analyzed the obstacles for the development of initiatives in workplace stress and psychosocial risks. And as you'll be able to see on the graphic on the left side, barriers for the implementation of initiatives in workplace stress and psychosocial risk as shown in the graphic on your right side of the screen. These were geographically classified, including Africa, the Americas, Arab states, and Asia and Pacific, and Europe and Central regions. As we can see from the slide, the following obstacles and barriers were top rated based on aggregated data at the country level. The lack of political will to develop and implement initiatives was considered a major issue. The culture of compensation rather than prevention. This is basically laws not aimed at prevention but focusing on compensation. A lack of awareness and of trained and qualified professionals, and a lack of data as well being reported and reliable statistics. And we know that a lack of appropriate expertise is a factor that has been already been mentioned throughout the webinar. And we really hope some of the learnings from this webinar will be most helpful to health and safety practitioners. basis, businesses have gone through challenging barriers. To this respect, we need to be conscious that the current approach is not working, and I think that we also need to be mindful that this subject is not going to go away. It will remain within the business. So in relation to some of the different challenges identified, organizations have found it easier to focus on the physical element than on its psychological, and invest in initiatives without measuring the effectiveness or impact of those. Embedding psychosocial risk management into business as usual is still a challenge that organizations will need to face. And on the same basis that we have governance structures in place for managing physical and process safety risks, we need to address the same focus to the less visible risks. Elisa, I guess you found a recent example that demonstrates this complexity in relation to the possibilities for recognition of work-related mental disease or disorder as an occupational disease. Is that right?
Yes, Ivan, indeed. In Switzerland, a parliamentary initiative for job burnout to be recognized as an occupational disease got rejected last February by the National Social Security Commission. The reason behind that was because the Commission considered that it was not possible to establish a definite link between the symptoms and the occupation. It is also considered that the prevention program already put in place by the private economy are substantial and there was no need for further actions. Along with the regulatory challenges and the challenges for business, we have other challenges, such as the stigma surrounding mental illness and the fear of talking about it. For example, according to another survey, around a third of people who have suffered from mental illness at the workplace have never sought any professional help for their problems, and about 44% have never disclosed their issues to a manager. All that being said, mental health issues and psychosocial risks are being addressed in a more unified way, and we have in that regard several laws, regulations, and standards on the global as well as on the national level. On the global level, psychosocial hazards and risk of work-related stress are included in a non-unified and fragmented manner, and that is in many national legal frameworks. From the top global influencers figures international standards and recommendations. Those are generally developed by international committees or organizations. Here, it's worth noting that the International Labour Organization has very recently adopted an unprecedented convention and an accompanying recommendation on violence and harassment in the world of work. The convention is the first legally binding international instrument introduced by ILO since 2011 with the aim of protecting workers and employees irrespective of their contractual status. The convention takes a broad view of avenues where violence and harassment can occur. It recognizes that such offenses can occur not just at the workplace, but in places where a worker takes a rest, uses sanitary, in washing or changing facilities, during work-related trips, work-related communications, and in employer-provided accommodation, among many others. The convention states that violence and harassment may also involve third parties. ILO has also developed other conventions and recommendations for the protection of workers, such as Convention number 155 on occupational safety and health and Recommendation number 164 protecting workers' physical and mental health and well-being. We also have few voluntary standards which provide guidance on psychosocial health and safety management processes, such as Standard number 10075 on ergonomic principles related to mental workload. The International Standard Organization also has several standards, including ISO 45001, which is the first health and safety international standard. In this standard, it is explicitly required to identify and control psychosocial health hazards. I should also note that the international committee behind this standard has drawn up a new draft guidance standard called on psychosocial risks in the workplace. A document that it says could be converted to a systematic guideline for employers to use for promoting, developing, and continuously improving psychologically safe and healthy work environments. Mental health has also been a key issue discussed in the revision of Global Reporting Initiative GRI 403, Occupational Safety and Health. and it sets out reporting requirements on the topic of occupational health and safety. The extent of the standard also involves both prevention of physical and mental harm. Here, I think it's very pertinent to say that while global influencers are important and should be definitely monitored, there is an added regional complexity that companies should be aware of, and that is of meeting constantly changing national regulatory frameworks. In many instances, when companies are found to be non-compliant with those frameworks, they face costly fines or litigation, and this can threaten their ability to conduct business in a given location. And so here INHESA helps companies through its regulatory forecaster by providing them with constant updates on change requirements concerning several EHS topics. Now, on a federal level in Europe, from the monitoring we did at INHESA, we had several changes in EU legislation. For example, the European Health and Safety Organization's founding regulations were updated to clarify that health and safety at work refers to both physical and mental health. Also, in June 2018, a report on the management of psychological risks in European workplaces was issued. Here, I should note that this report does not directly impact companies, but it provides data to policymakers, and it could contribute to OSH policymaking. We also have wide debates on the possibility to draft a specific European directive on psychological risks for stress. On a national level, we also had great developments with regard to the right to disconnect, with France being the first country to introduce this right. Belgium followed France with the law of 26 March 2018, according to which discussions are supposed to take place between employers and employees on the matter of techno stress, and that is whenever it has been required by employees for the Prevention Committee. In the Netherlands, a proposal for an act to encode the right to inaccessibility in the risk analysis and evaluation of every employer has also been submitted as well. The open consultation ended in March 2019. In the United Kingdom, a guidance has been introduced to help employers introduce mental health first aider into their workplaces and better understand their responsibilities, also their boundaries. And that has followed from a very big campaign that was national, and it wanted to create a legal duty on employers to train staff in mental health first aid by amending the first aid regulations.
That's really interesting, Elise. Thanks for providing a great picture of what is going on at a European level. We are now providing a brief snapshot of the situation in the South America region. We can see how some countries, as the case of Mexico, have a detailed definition of psychosocial hazards and risks in their OSH legislation. But we must acknowledge that even when there are laws governing, they are often not meaningfully implemented. And the fact that regulations exist doesn't imply enforcement and compliance. We then tried to show the different regulatory approaches in the South American region and how some states cover the protection of mental health and well-being in the workplace as a general duty of care, while others opt for articulating specific definitions of psychosocial hazards or the reference of the protection of these risks within the scope of OSH regulations. So, reference to the protection of mental health and well-being is articulated within the scope of occupational safety and health and existing regulations. And this is the case for countries such as Argentina, Bolivia, Colombia, Costa Rica, Cuba, and Venezuela. The protection of mental health is considered as a general duty of the state for all citizens, and that's exactly the case for Chile and Peru. Or the extent of this protection needs to be covered by existing health and safety institutions. This is the model in the Dominican Republic. And finally, specific legal definitions of psychosocial hazards and risks in health and safety legislation, and that's the situation in El Salvador or Mexico. In this context, national data on the magnitude of the problem that can influence public policies, unfortunately, is still weak. Um, the region is also characterized by high levels of underreporting that limit accurate information gathering. To this respect, it's important to acknowledge that lower levels of awareness should lead to lower levels of reporting. Asia and the Pacific is an area with diverse complexities in approaches and strategies for mental health and well-being. On the other side, the development of a specific related legislation has increased in recent years in several countries. The whole region combines advanced industrialized economies like Japan or Australia with emerging countries, the case of India and China, and developing economies such as Vietnam or Indonesia. It can be denied that it's also a strong influence from theories and robust regulatory frameworks developed in Australia or New Zealand, and Europe to a lesser extent, and this is probably the case of Singapore. According to evidence-based research, there's a growing interest in psychosocial hazards, and including aspects such as irregular work shifts, workplace bullying and violence, precarious employment, and job insecurity. At the same time, prevalence of work-related stress and mental health issues are reported to be increasing within the workforce. Excessive hours of work and long working hours is also embedded within the business culture, and in some cases are becoming an endemic problem. In this context, some researchers alert of emerging issues in relation to work-related female suicide rates, and there's also an increasing cases of workers dying of fatigue-related illnesses caused by long working hours. We can see from the slides examples of relevant legislation in countries like Philippines or Indonesia, but we need to be mindful that levels of implementation and enforcement are still low. And we know that legislation is not effective without appropriate enforcement. On the contrary, psychosocial hazards are being increasingly recognized within the Australian work health and safety, national legislation and policy framework. We will now be finishing this global picture with Canada, together with Australia, one of the best examples of a regulatory preventative approach. There are 14 jurisdictions in Canada, 1 federal, 10 provincial, and 3 territorial, each having its own occupational safety and health legislation, what makes it a sort of unique regulatory framework. Canada is also one of the first examples of non-binding technical standards on psychosocial risk prevention and management. The national standard was published in 2013 by the Quebec Bureau of Normalization in collaboration with the Mental Health Commission of Canada. And this is the first national standard that targets psychological health and safety in the workplace, and that is also auditable. Under existing legislation, employers have a legal obligation to maintain a physically healthy and safe workplace. And I think it's fair to say that there's a legal assumption that this is also inclusive of the need to maintain a psychologically healthy and safe workplace. In this context, workplace practices that create the risk of mental injury could also lead to legal liability. And I do believe it's worth mentioning that the province of Quebec is planning to go through the reform of the occupational health and safety system by end of this year. And psychological health at work will be part of a key part of this reform. We have tried to present the best possible overview. We hope this will give you a flavor of the work being covered. But if you'd like further information on a particular jurisdiction, I'm pretty sure my colleagues of NHISA would be happy to help, considering their demonstrated expertise in the field. And before Lindsay sums up the conclusions, Elise will go through some good corporate practices that she has found.
Thank you, Ivan. So on a corporate level, we are seeing that companies are recognizing the effect and consequences of mental health, and they are trying to leverage employees' experience. We can also see several examples in Germany where the protection of employees from techno stress is at its highest. For example, employees of Volkswagen can no longer send emails half an hour after the end of the working day. In Daimler, employees can activate an auto-delete in their mailbox during the holidays. And the employees of BMW are also no longer obliged to respond to emails of their bosses after working hours. Companies are also paying more attention to well-being, and they are putting in place several initiatives to ensure employees are well placed and they are not affected by psychosocial risks. For example, Johnson & Johnson have a business arm called the Human Performance Institute, which helps to promote health and well-being as a service. So they also have trainings, for example. And Deloitte, along with other companies, are working with them as well with other entities as well to improve their corporate well-being.
As we've seen from the examples given by Elise and Ivan, there are varying approaches to regulation and policy to try and protect workers' mental health. However, the existing legislation in this regard tends to be very general in scope, largely relying on general duty to look after employees' physical and mental health. But it's also largely reactive rather than proactive. Although some countries are taking the lead, the approach remains fragmented around the world. In many countries, the complexity involved in regulating something as sensitive as mental health is perhaps slowing down progress, and many countries consider the existing regulations adequate. On a similar note, many countries are focusing their attention on developing voluntary policies and guidance to assist companies in managing the mental health and well-being challenge. This is likely to continue in the coming months and years around the world. There will also be key developments at the international and EU levels in the coming months and years that will have major impacts. Additionally, the focus is turning to well-being rather than simply mental health. And the cost industry is being reflected in as many companies take the lead. This more holistic approach is evidenced by the initiatives companies are taking to try and positively impact workers' lives. There is a real recognition that this issue can impact productivity and ultimately the bottom line. So companies are taking this very seriously. Now, let's try some questions that you submitted upon registration. Ivan, I recently heard that the phrase 996 came out of China and wondered if cultural attitudes, in Asia in particular, will prevent any effective regulation.
I think this is a really good point, Lindsay. As previously mentioned during the webinar, work intensification tends to be embedded within the workplace cultures in many countries in the Asia-Pacific region and East Asia region. And I think I also remember that throughout the webinar, when presenting the landscape in the Asia region, we have cited the case of Japan regulating on long working hours or on work overtime. And I think there's also like some evidence, recent evidence from the ILO that alert of how prevalent is the proportion of workers working long hours in this region. And I think it was recently in the news that many of us have recently heard about deaths within election staff in Indonesia due to fatigue caused by long working hours when counting millions of ballots papers by hand. And I think it's also like fair to say that we also need to be mindful or put the focus on the workplace culture and how like management styles, power balance, or workplace authority, um, and even things like employee surveillance or monitoring operate and are implemented in practice in the region.
And following up, another question for you, Ivan. Does IOSH provide any advice, guidance, or training around workplace mental health and well-being?
Yes, we do. We do indeed through the different initiatives, such as like policy influence, research, technical content, or training activities or awareness campaigns. I mean, it goes without saying that this is also a knowledge and skills gap identified in um, many health safety practitioners. So I can tell you that this knowledge is much needed within the industry. And I think that apart from what it has already been mentioned in the beginning of the webinar, there's like a couple of initiatives that I think is worth highlighting. Um, we recently launched Managing Occupational Health and Wellbeing course that provides practical advice and tools for managers to help create healthy workplaces. And workplace mental health and well-being will also be a key subject under the IOSH conference that is taking place in September time in Birmingham in the UK.
It sounds like IOSH is an excellent resource for companies looking to further their mental health and well-being programs at work, so that's great to know. Following up on this, why do you think it's only been in the past few years that the impact of mental health in the workplace has started to be recognized?
I think it's fair to say that in the beginning of the webinar, Liz provided some key facts and figures that demonstrates the business case for mental health and well-being to be proactively managed. And I also think that there's a momentum out there, especially in industrialized countries, reinforced by different sources. So this could be coming from regulatory sources, social media, or from the workplace. And I remember recently publishing on this particular topic, and I remember calling it silence revolution. So in this context, I think that the concept of duty of care is little by little changing from a legal approach to a moral duty of care, where companies, organizations tend to have a more holistic approach, covering not only physical health, but also mental or financial and even digital aspects of well-being.
Okay. Thank you, Ivan. That's very interesting.
You're welcome.
With this, Elise, do you think it's going to be possible to regulate well-being?
Well, I think that this webinar has provided a good picture of how regulations are likely to shift from the moral to the imperative need of regulating well-being. And we also saw the challenges regulators face when trying to regulate this issue. However, I should say that the issue of regulating well-being will depend on many factors, but we should always keep in mind that this will become a paramount issue in the future of work. And with the increase of technology and major transformation in the world of work, we will definitely need more regulation in this regard. Together with being said, I have to be mindful that this approach is much related to industrialized economies. So because a large population still works in agriculture and in developing economy, this context is still very difficult for them. So we need to be mindful of this approach as well.
Okay. With this future of emphasizing well-being, how will regulators distinguish between home and quote-unquote work life?
So as we saw, boundaries between professional sphere and the life in private is a bit difficult, and sometimes it's very blurred. However, we are seeing lots of recent initiatives that are trying to regulate the right to disconnect, but I still think that it's still too early to determine the benefits from regulating in this topic, and we still don't know how this will go further. But it has a very strong complexity in it, and sometimes it will be very difficult to distinguish this time, taking in account that we have now more flexible work and we have telework as well.
Okay, thank you so much to both of you for sharing your expertise on these topics. Okay,
you're welcome, Lindsay.
Yeah. Those were all the questions we have time for today. Thank you to both Elise and Ivan for sharing their expertise, and thank you to all the attendees who have spent an hour of their day with us. If you have any additional questions, feel free to email info@enhisa.com, and we will pass your questions along to Elise and Ivan. Be on the lookout for a follow-up survey in the next 24 hours, where you can submit future webinar topics you would like to see from us. Thanks, and have a safe and compliant day.